Good afternoon. I want to talk today about hand hygiene, and that is one of the most important things that you're going to learn when you work in the nursing profession. Hand hygiene is the first defense to preventing infections. We have bacteria all over our body, and that's normal and that's okay, but we also need to protect our residents and the people we're caring for from that bacteria and other bacteria we could have picked up in other areas. So it used to be hand washing was the most important thing with soap and water. Now things are changing to be more where you use an alcohol-based hand sanitizer. The times that you should use an alcohol-based hand sanitizer would be before immediately touching a resident, performing anything that is a clean or sterile technique, before moving from a soiled, which would be a dirty surface, to a clean surface. So anything that is like an incontinent products on a resident that is dirty, if you're going to put a clean product on, that is clean. So then you would need to sanitize your hands after doing that. Anytime you touch the resident or the environment, their tray table, their person, those are all considered dirty. And anytime you have contact with body fluids, contaminated surfaces, and then before and after you put on gloves. One of the things, there's a few times where you are supposed to hand wash instead of use alcohol-based hand sanitizer. And you should hand wash whenever your hands are visibly soiled. So if you've got dirt or whatever all over your hands, you're not going to just try to rub that in with hand sanitizer. You're going to go to the sink and you're going to wash your hands. And then there are a couple different infections that could cause usually pretty watery, smelly diarrhea. It's pretty characteristic. You usually know when somebody has C. diff, and that's a time where you're going to need to use soap and water because the alcohol-based hand sanitizer will not kill that bacteria. So we're going to start with hand sanitizer, and at the facility I work at, we have hand sanitizer everywhere. So in each bathroom, also there's going to be hand sanitizer, not even just where there's a sink. So if you're in there with a resident and you're helping them get off the toilet, once your hands are dirty, you've wiped the resident or assisted them in anything dirty, you can go right over here. 3. Okay. So if you're in the bathroom with the resident and you're assisting them with hygiene after they've been to the bathroom, before you assist them with pulling up their clean clothes, you're going to go to the hand sanitizer, get an automatic amount. These are really good. They give you just the amount you need. You're going to rub these together until your hands are dry. You're not going to do a couple seconds and then wave them around like this to help them dry faster, because that's not going to do what it needs to do. You're going to continue to put your hands together until they're dry. One thing I've learned over the years is that people wear their scrub tops and they have pockets in their scrub tops, and people like to stuff all the things they need in their pockets, but your pockets are considered dirty. So there's usually small hand sanitizer bottles that people like to carry around with them so that if there's somewhere where there's not a dispenser, they can grab that. And a way to do that, since your pocket is dirty, is you're going to reach into your pocket with your hand. You're going to take your sanitizer. You're going to put, about a nickel or bigger size in this hand. You're going to use this other hand, put this back in your dirty pocket, and then you're going to take this and rub this in for usually around 15 to 20 seconds or until dry. So this takes a little bit of while. Okay, so while we're waiting for this to dry, the next thing we're going to do is talk about hand washing. And hand washing, the most important thing too is making sure you have all the supplies. Make sure you have paper towel with you, make sure you have soap, water, and you have a garbage can. Those are the main things that you need. So when you're hand washing, you have to think about all the things that are dirty in the process. It's not just your hands. Your sink is dirty, your garbage is dirty. If this soap container or soap dispenser isn't automatic, the handle on that's going to be dirty. So there's a lot of dirty things in the process. You have to think about that when you're looking at what you're touching. So to start, you're going to turn on your water, and you want to have not really, really hot water because that can be difficult on your hands. And this is a really loud sink, so hopefully you can hear me over. So I'm going to get my hands wet first. And since I just sanitized like 3 times, I'm going to rinse them just a little bit. And then I'm going to get my soap, and what I'm going to do is I'm going to wash my hands for 20 seconds. Mallory's gonna help by putting the timer on to let me know how long 20 seconds is. 20 seconds is actually a really long time. When you are washing, it doesn't seem like it's that long, and you're probably only 7 seconds, and you think it's probably time to be done. You're gonna make sure you get between your fingers like this. You're gonna try to get under your nails by doing that. We're finally at our 20 seconds. But as you can see, that really was a lot of rubbing and scrubbing. So once I've completed that, I'm gonna rinse. And this area up here I didn't wash, so this is considered dirtier. So I'm gonna have my hands down, rinsing the soap downwards so I'm not rinsing out my arms. Then I'm gonna grab a paper towel. Once again, I haven't touched anything else besides the clean paper towel that I'm using. Then I'm gonna throw that away. And then I'm gonna get another paper towel and I'm gonna turn off this water. Because those dirty hands that I just came with and turned this water on, if I turned it off without the paper towel, I would be getting my hands dirty again. So then I'm gonna throw that away. And that, ladies and gentlemen, is how you do hand hygiene when you're working in a nursing home. Thank you for your time.